Hi, I'm Tammy Potter, and welcome to the Pregnancy Process Podcast, a show designed to help you navigate the hugely transformative journey to motherhood, where you'll hear the unique experience of experts in this area and the incredible stories of women sharing their conception, pregnancy, and postnatal journeys so that you can have a healthier, more informed pregnancy. In today's episode, I talk to cosmetic physician and mother of two, Dr. Cosima Karlburger. Dr. Cosima is one of Sydney's most experienced cosmetic physicians, having trained at prestigious cosmetic clinics from Beverly Hills to Berlin. She's an internationally recognized thought leader, industry trainer, and key opinion leader for Galderma. And today, we're challenging the myth that you simply have to wait it out when it comes to pregnancy skin concerns. If you've been told that everything from pigmentation to redness and hormonal changes are off limits to treat until you've finished breastfeeding, or if you've felt confused by conflicting internet advice around pregnancy skincare and treatments, this conversation is absolutely for you. Because in this episode, Dr. Cosima breaks down exactly what is and isn't safe when it comes to skincare and treatments during pregnancy. We talk about the ethical considerations behind treatment decisions and why doctor-led practices matter when helping women feel empowered rather than restricted. We'll explore which laser technologies, chemical peels, professionally compounded serums, and supplements are safe across each trimester. And you'll discover why taking a preventative approach means you can emerge postpartum without facing a mountain of skin damage to repair. Dr. Cosima, thank you so much for your time today. It's fantastic to have you here with us.
Thank you so much, Tammy.
For those that don't know, Dr. Cosima is my secret weapon. It's not so much of a secret anymore. So I'm really excited for you to share from your absolute wealth of knowledge around skincare. I know for me, coming to see you has been a game changer. So let's dive in with when women first discover that they're pregnant. So there's often a lot of confusion, and skincare is no different because there's a lot of ingredients and treatments that are actually safe versus what the internet tells women to avoid. So what's your approach when it comes to helping pregnant patients navigate the pregnancy skincare myths and misinformation? You know, the do's, don'ts, cans, can'ts. But I think more importantly, why should internet research never really replace professional medical consultation?
It's a little bit of a complex situation because when we look at the internet, often people type things in that are incorrect information, and that's what AI draws from. When it draws from reliable sources like where your skin needs lie, obviously the process should start well before pregnancy, but we need to just consider that as soon as someone's trying, we steer clear of things like very strong salicylic acids or retinols because they can be teratogenic. So what that means is it can influence the developing fetus. However, most skincare products are actually safe.
When you say most, besides from the two that you've just mentioned, being salicylic acid and retinols, are there any other things out there in the skincare world that people should stay away from?
So there's more prescription medications that people need to stay away from. Tretinoin, hydroquinone, corticosteroids without being under the guidance of a doctor, obviously. And I think people get really scared of having other ingredients that are potentially toxic or non-organic in their skincare. Remember, it's topical. Our dermal barrier is very good at controlling what gets in through the skin. So unless it's any of those specific ingredients, then the risk of actually getting into your systemic circulation, which is what can potentially affect the fetus, is next to nothing.
And I guess in the whole myths and misinformation realm and the do's and don'ts, can'ts, is there something that keeps popping up around this and around pregnancy skincare that you'd like to demystify a little bit?
So the thing that obviously comes up a lot is that we need to start using pregnancy safe products, or we can't use any active ingredients or active products. So again, I think it's really important, especially for first time pregnancies, or if anyone's ever had a missed pregnancy, then it's very concerning regarding what could be going wrong. So I think just considering the ingredients in general as to being toxic or non-toxic or having to go organic is the biggest thing. I know people worry about the what ifs. And like I said, it's a person to person, individual choice as to which pathway we choose. The only thing I say is make sure you do continue to look after your skin, because that's where the hormones start to impact the function and the barrier of the skin, the pigmentation, and obviously skin can be a lot more sensitive during pregnancy, and we just want to make sure that the process is a guided process rather than going through it by yourself.
Okay. And you've opened up plenty of little doors that I feel like we're going to go down. You've talked about the what ifs aspect of it. You've talked about the doctor-led practice. You've talked about pigmentation. You've talked about all these skin concerns that happen during pregnancy. And I know that we're going to dive into all these as we continue this conversation. But I think as we continue through this, the question that I do want to ask now is, what specific advantages does seeking treatment from doctor-led practices provide during pregnancy that, say, spa or beauty clinic settings might not offer? Because obviously there's a range of beauty products and services available, and there would be a difference between going to see a doctor-led practice than, say, a spa or just your typical beauty clinic.
Yeah, absolutely. So spas are fabulous. I think they're great for feeling good, fabulous for treatments that include skin hydration and pregnancy massage, and obviously really beautiful for mental health, which is so important during pregnancy, especially with all the hormonal changes and the life changes that occur. However, seeking advice from a doctor-led clinic means that we can delve into your medical history, we can look at your skin through a skin analyzer, have a look at anything that might be underlying, including things like inflammation, which can be very common during pregnancy, see whether or not there's skin changes like dehydration or increased oil production, so whether or not we need to consider combating that, whether or not some of the hormonal pigmentation such as melasma is coming to the surface, and then obviously having a medical background, knowing about things like rosacea, which can be triggered by pregnancy, knowing all the things that can be triggered during that hormonal change and what is safe in trimester 1, 2, and 3, how we prevent things from establishing or getting worse during that process, then we can treat it from a more medical aspect as opposed to just a feel-good aspect. So we're actually working to prevent and achieve something, because I see a lot of ladies after giving birth and they're really struggling with their self-esteem, not only obviously all the body changes that Tammy can help with, but also all the skin changes. Like, people may not have ever had breakouts before they're going through breakouts, or they've never had hormonal pigmentation and suddenly their face is looking really blotchy. So it's best to get onto that sooner rather than later.
And I think that's one of the myths and misconceptions I would see, is that people think that you can't treat this stuff during pregnancy.
Mm-hmm.
But the reality is you actually can. It's just going to see a doctor-led practice that can take you through that journey safely, versus just leaving it for the duration of your pregnancy and being like, okay, I'm going to have to deal with this postnatally. Interestingly, I was just talking to one of my clients yesterday who's 2 years postnatal now, and she's still got some stuff underneath here from her pregnancy journey. So that's a really perfect example of things that you can target during pregnancy rather than just leaving it till later, but knowing that you feel safe in a doctor-led clinic. Now, I think I really want to talk about this now because
Okay.
there's a little bit more invasive aesthetic treatments that people are having these days. And I know that there's certainly some ethics around those during pregnancy. So, can we talk a little bit about the ethics of invasive aesthetic treatments during pregnancy? But I am also curious about local anesthetic use because I know that's part of it as well, because it's considered safe for medical purposes, but it's contraindicated
Correct.
for aesthetic treatment. So let's just delve into that side of things.
Yeah, that's an awesome question, Tammy. And I think a lot of people are really confused by all of this. Now, I have treated in the past ladies that haven't expected to become pregnant with more invasive treatments, and there's been absolutely no consequences. There's no studies that show that there are any consequences. I've never heard of there being any problems during pregnancy processes if they have had a treatment. Obviously, I'm not allowed to mention what those specific treatments might be because that's part of the medical guidelines. However, we know what those more invasive aesthetic treatments might be equal to. And I suppose it's just related to the fact that ethically we can't do studies on pregnant women to deem safety of treatments. That's one of the factors. So it wouldn't be right to say, okay, let's test XYZ women. Some people have the treatment, some people don't. Let's see what happens. That's obviously not possible. However, from a molecular perspective, there is no evidence that it would be systemic, that there could be any impact upon a fetus. So if anyone has had any treatments done and they're concerned, they don't need to be. Obviously, with the local anaesthetic, again, it's because of the ethics during aesthetic treatments. If something is not medically required, as a doctor, I need to keep in mind your mental health as well and the impact that any treatment might have should the pregnancy process not continue, should there be any issues afterwards, that we then don't think back and say, could it have been this? Could it have been that? So we want to minimize any of those risks. Obviously, with some of the more invasive treatments as well, there can be risk of infection. So we don't want to be using antibiotics unnecessarily while someone is pregnant. And they're the real reasons why we don't do these treatments, as opposed to the fact that they're innately dangerous.
I think there's so many good points in all of that, because it's the same as coaching someone in training in that very first trimester. Like for my clients that have come to me prior to their pregnancy or while they're trying to conceive, and they conceive during our training, obviously not during our training, that would be a bit weird, wouldn't it? Like they conceive while we are training together. That just doesn't sound right, does it? Anyway, you know what I'm trying to say.
Do you have a second job you're not telling me about?
So they're in their first trimester and they're still training with me. Even though the guidelines say you can continue to do everything exactly the same, and everybody is different, but I will typically, straight from the minute that they tell me that they're pregnant, I will make alterations to their sessions purely because of that what if factor. Even though they know, I know that there's a genetic component if the pregnancy doesn't go to full term, there's a genetic component of it. But you would never want to look back and be like, what if I didn't do X? What if I didn't do Y? Would that have changed things? And I think taking that mental load off someone is really important, especially when there's so much else going on. They don't want to be worried about that too. And I think that brings me to another really important point that you did mention, is that if someone has had a treatment and they didn't know that they were pregnant at that time, it's okay. So I think that's very reassuring for everybody listening. Now, in terms of the what if factor, because we have spoken about that a little bit, how do you help women process the psychological aspect, the what if factor, where they worry about potential regret if something were to happen after receiving treatments? How does this influence your approach to treatment recommendations?
So obviously I only recommend treatments that I know are pregnancy safe, and during different trimesters treatments are safe. As I mentioned, or I should rather specify deemed safe, so proven to be safe, as opposed to we know they're safe but they haven't been proven to be safe. So there's a difference between that as well. For example, during the first trimester there's treatments that we can use that have gentle sort of components to them. So they're more superficial treatments for the skin where we're not delving deeply, penetrating into some of those deeper skin layers. So that's something that the first trimester is a little bit limiting. And again, not necessarily just because of safety, but also, again, because it's the most high risk time period. We don't want to be causing too much stress to the body, so we don't want to be doing any treatments that could potentially overheat the body or cause too much pain and stress levels from that aspect. But moving on to the second and third trimester, when things are a little bit more established and it's well known that the risk of not carrying to term is lower, that's when we can start doing some of those stronger treatments like laser treatments as well.
So many women don't actually realize that treatment safety, and I know we've touched on this previously, but they can vary across the trimesters. Can you walk us through in a little more detail why certain procedures might be contraindicated in the first trimester but become acceptable later, and what changes in your treatment recommendations as pregnancy progresses? Because obviously, like you mentioned before, what you can't do in the first trimester, you can certainly do in the second and third. So can we talk through maybe what that might look like if I say came to you in my early pregnancy, or I was already seeing you and then I was like, oh, next time I came to see you, I was like, oh, by the way, I'm pregnant. What did that process look like? And understandably, like everything, there's a lot of personalization in it, and it would depend on what their skin concerns were. But let's walk through that.
Tammy, what I can do is I can speak from personal experience. I've
Okay.
two pregnancies, two full-term pregnancies, and so I know the journey from finding out to saying, oh, could I quickly do a treatment before it's really official? No one's going to know, right? And this is going to be 9 months without anything. Having prepared the skin really nicely in the lead up to pregnancy is already something that's so important. And I think these days we're more into preventive treatments and looking at skin health and skin quality, which I think is so important. So that sets us up. We need to set ourselves up for success. So I find that in the past, I used to see a lot of women come in and have those really terrible hormonal changes in the skin, breakouts, pigmentation, redness that we spoke about earlier. However, now people's skin seems to be responding a lot better because we're strengthening it in advance. So we're basically setting it up to have a much better response to the change in hormones and stress levels. So for myself, what I organised straight away was a compound serum. So we have some doctor-only products. There's a particular brand, a couple of brands out there that we can create a specific treatment. So it's almost like a take-home treatment in a bottle where we're achieving certain goals. So we can look at targeting specifically pigmentation and redness and reducing the risk of breakouts all within the one serum. And we can make that bespoke and personalize that. So that's something really helpful, obviously, depending on what the concern is. Often we need to strengthen the capillaries in the skin and the blood vessels because we know that the volume in a pregnant woman is a lot higher, the stress on the blood vessels is a lot higher, and that is part of the reason why we get that redness and flushing, but also part of the reason why we grow in during pregnancy. So we've got a really fabulous treatment mask from the US called CO2 Lift Pro, and that's something that can also be used in the first trimester to help oxygenate the skin, reduce any inflammation in the skin, and also strengthen the skin with the view to carrying that throughout the pregnancy as well, so that you're coming out the other side with a healthier skin. The other thing that I find is really important is obviously internal supplements, and that's something that you don't want to necessarily take off the shelf without some medical advice. Again, I do carry a very premium range of antioxidant and collagen supplements as well that are incredibly helpful for reducing inflammation in the body during pregnancy, and I took mine throughout both pregnancies, so it is pregnancy safe, and I found that really helped my energy levels, my skin as well. So again, everyone's really different in terms of what I would advise, but that's just some examples there of what can be done so that you feel like you're actively helping the process. Obviously, once you get to second, third trimester, where you're starting to announce things to people, where all the fetus's organs and everything has been developed, that's when we can start to look at treatments like laser treatments, where yes, there is some heat that goes into the body. Obviously, we use a very particular type of laser called the Aerolase Neo Elite, one of the latest technologies that doesn't create too much heat in the skin, because during pregnancy the skin is, nonetheless, no matter what we do, it is more sensitive. So it's more prone to pigmentation, more prone to redness. To a degree, it will be just sensitive in general. Theoretical risk of developing the post-inflammatory hyperpigmentation that we can see sometimes, especially if there is hormonal pigmentation. We need to be cautious not to use IPL machines because that can actually make it worse. So there's a particular type of laser that we use that will help to suppress all those inflammatory components. That's the Aerolase 650 microsecond. So that doesn't mean a lot to a lot of people, but it's a very safe technology, and that's why I brought it on board, and that's also why I love to use it on my patients during pregnancy. So it's for overall skin health as well, but specifically during pregnancy, it's the one thing you can do to contain that overexpression of what we call melanocytes, which are the pigment cells, or constrict that vasodilation that's causing that redness and broken capillaries in the face as well. That's just one example. There's other examples out there as well, other treatments that we can do and do. But that's, I think, a nice way of giving you an idea of the possibilities out there.
That's amazing. And I guess this is why you need to go to a doctor-led practice versus, say, a day spa or a beauty therapist, is they may not know these things, and then they may not actually have anything that they can safely use during pregnancy. And one of my clients said to me a little while ago that during pregnancy, they typically have a little bit of extra money to spend on some things. Obviously, pregnancy is very expensive in some aspects, but they're not spending money on other things, right? Like,
Going out drinking.
they're not going out drinking. They aren't spending money on other aesthetic treatments that they can't do, but they still want to do something, because pregnancy is a time where many women just don't feel their best selves. And don't get me wrong, some women do go through pregnancy and they're that beautiful glowing version, but there's many women that go through pregnancy and they actually feel terrible, and they don't think that they can do those deeper treatments that will actually really help medically with what's going on with their skin. Now, the compound serums, that sounds really interesting. Is there anything further that you can talk us through about the compound serums and how you can achieve clinical results with them during pregnancy?
Yeah, absolutely. So again, like I mentioned, they're very targeted. So we can do different combinations, different strengths of particular ingredients. It comes in a base formulation that has peptides and hyaluronic acid in it. So that's completely pregnancy safe. There's no preservatives in that. So it is something that we make up on the spot. We do the skin analysis first. So we look at whether there's deep or superficial inflammation or sensitivity. We look at if there's any underlying pigment cell hyperactivity, so something that we need to suppress, especially during the pregnancy process. And we can look at anything else in terms of porphyrins or bacteria in the skin to decide which ingredients are best to put in. Obviously, it will depend a little bit upon what you've had in the past and how your skin is currently responding to the pregnancy. So you can start these anytime during the pregnancy. The good thing is as well that we do change them. So generally they are made for about a 3-month course. And because the skin does change during the pregnancy process, we will adjust those formulations accordingly as well. The good news is we leave out things that are retinols. We can use alternatives like madagascar that help to strengthen capillaries and vessels as well as build collagen. We leave out any salicylic acids. We can adjust and use a different type of either acid or exfoliant as well as antioxidants in that. So the things that we can do also means that there's specific things that we can leave out that can cause sensitivity or are not deemed safe during pregnancy.
That's amazing, isn't it? And I love the fact that you can adjust it over pregnancy. This actually really reminds me a little bit of training, right? Like the initial stages, you want to be a little bit more cautious and you don't want to have those what ifs. And it comes back to that personalization aspect of it. When you do see someone that can do all this, it's a journey that adjusts with your pregnancy. So you might start taking things out, but then as you go through, you can adjust things depending on what's happening with your skin. So it's got a bit of a mirroring effect, I'd say, of what happens when you train during pregnancy. And it's not like you can't progress your skincare. You might start off taking things out and not doing certain things, but it can certainly progress over time and you can add more things in as the pregnancy progresses. I think that's really cool. Now,
yeah, absolutely. And with those ingredients, there's over 2 million different types of combinations. So it is very personalized. And I think what people don't realize is that when you're pregnant, especially, but also when you're not pregnant, it's really important to adjust skincare accordingly to skin needs. And unless you're in the profession, it's not your job to know if you've got dry skin, oily skin. We do tend to ask because people have this idea in their head of what skin type they are, but often it's different. It's either dehydrated or there's other underlying concerns or conditions. And it's our job, because we do it day in, day out, as a multidisciplinary team to actually identify those factors. And I find that because we are so focused on skin in my practice especially, that even people that have been to specialists for their skin are finding there's huge benefits from all these adjunct treatments. There is one pregnancy safe laser called the bionic laser for the first trimester. So that's one where we're adding hyaluronic acids and antioxidants to the skin superficially, and it's a cold laser. So there's none of those risks of heat. It's got infrared light, and we all know infrared saunas are great. So that's something that you can also do and continue to help stimulate collagen in the skin as well as calm down any redness and already start the process of controlling pigmentation. In the second trimester with the Aerolase Neo Elite, for example, that's when we start to target capillaries. So we're actually reducing the size of the capillaries. We can target what a lot of people don't know is the capillary-fed melasma. So you would have heard of probably hormonal pigmentation, which is called melasma or cloasma. And what a lot of people don't understand is that there's a component of blood vessels that feeds this particular type of pigmentation. For example, other types of lasers that exist, like a pico laser, can work really well on the pigment, but it doesn't get to the cause of the problem, which is that vasodilation, which is actually making those pigment cells overactive from a hormonal perspective. So Aerolase Neo Elite, using a very short pulse, so it doesn't create a lot of heat in the skin like many other lasers do, making it a safer alternative during pregnancy as well, because the skin has a tendency to overheat. We use it to suppress that inflammation. The benefit is at the same time, it is also starting to break down some of those pigment cells at a deeper layer. So not superficially, it doesn't cause burns on the skin, but it's breaking down that deeper pigmentation inside the skin. And then also at the same time, it's helping to build collagen, because that gentle heating of the tissues does activate cells called fibroblasts, and they are the cells that build collagen in our skin. So it's a really multifaceted treatment approach, but very gentle. So that's the primary reason that I find it's one of the safest treatments to be doing for the skin during the second and third trimester, to maintain that healthiness, to maintain that glow, and to prevent you from actually having a problem down the track that you need to then go and fix.
I think this is very cool, because what I'm getting here, and I think, again, I'm just going to bring this back to how women typically feel during pregnancy, which a lot of the times they're not feeling their best. Let's be real. And then on top of it, I think these days there is a significant portion of women that are getting a little bit more invasive treatments, which they don't have access to during pregnancy. So then they've got a whole pile of other things happening, and they're seeing changes in their face, and they feel like they can't really do anything about it.
I think it's a matter of, you feel like you're not as empowered. I mean, I guess for me personally, and it depends, some people really enjoy the pregnancy process. They love it and they wish they could be pregnant all the time. I personally didn't. And I found that sort of difficult. It's probably feeling a little bit of that loss of control over your own body, because it's doing things to you rather than you doing things to it. So being able to take some of that power back, I feel, is really important. And then also, Tammy, as you would know, everyone is so different. So there's a spectrum of skins. It goes from absolutely perfect, I've never had better skin in my life, to I can't believe what's happening to me. Now I can't get anything done and I have to wait until I've finished breastfeeding even. So that's not something that we have to live by anymore. There are treatments out there that we can do safely. And I think mentally, for me, it's probably the most important factor. So anything aesthetic that I treat is really based on improving someone's mental health and how they feel about themselves.
And again, I can attest to all of what you were talking about before in terms of the pigmentation and the hyperpigmentation based on the vasodilation, because I definitely have that, and it's definitely so much better. And something that really worried me is that it was going to start creeping up my face. Anyway, too much information there.
And that's not being pregnant, Tammy.
No, exactly. So I can only imagine if I did go through that, it would definitely get worse. But you have mentioned some other things like your supplementation and also some other treatments. So you touched on the CO2 lift, and I know you offer some skin needling as well. I know there's some chemical peels that you guys do. I think you've got lymphatic drainage at the clinic.
Because obviously you get a lot of fluid retention, so that's for general health and well-being as well, really beneficial and pregnancy safe.
Yeah. So can you talk us through the other treatments that you offer that would be able to be used during pregnancy?
Yeah, absolutely. So for example, the Slim Ionic, which is the lymphatic drainage suit, works by helping to activate the lymph system. And obviously, as we know, in the abdomen, the compression, especially in the second and the third trimester, the compression of all the vessels means that we get a lot of fluid retention, especially in the legs. So helping to relieve that with this device actually means it's a scientifically proven way of activating the lymphatic drainage system, rather than, I know there's some other devices out there, I won't name them, but often you find them in gyms that do partial compression, and so it feels like it's helping with lymphatic drainage. They're more targeted at releasing the lactic acid. What our device does is it works on activating lymph nodes and helping to release that lymph fluid, which again, like I said, because of that pressure in the abdomen where most of the lymph nodes sit, it does seem to stagnate in the legs for some people, obviously also in the hands. And we just develop so much fluid that it makes us feel uncomfortable during pregnancy. So it's a really good treatment to do, maybe even just once a week, just to help maintain that natural toxin flow
Yeah.
throughout the body.
Amazing. So that's slimonic lymphatic drainage.
Correct.
And
Yeah.
you mentioned an oxygen mask. Is that CO2
Yeah,
lift?
that's the CO2 lift. Mind you, the Slimonic also comes with, you can have supplemental oxygen with it as well. So that's really great for oxygenating the whole body. Especially, we know during pregnancy, again, our oxygen requirements are much, much higher. So that it will help to refresh the body and improve oxygen exchange in the cells. So that will help with how you feel in general and your well-being status. The CO2 lift mask is incredible. So it's so safe. It gets used on open diabetic ulcers. It can be used immediately post-surgery, so on open wounds and things like that, to help oxygenate the skin. But because of that effect, it's a specific chemical reaction that happens within that mask. So chemical doesn't always mean bad. It's oxygen and carbon dioxide, okay? Carbon and oxygen. So if anyone knows either carboxytherapy or hyperbaric oxygen, it's that effect, but it's created on the skin. So it helps with hydration, skin clarity, skin cell rejuvenation, skin firming. It will help with reducing any inflammation in the skin. It can be used on eczema, dermatitis, all sorts of things. And the fact that the Bohr effect, which is what makes the cells get oxygenated through that mixing of the mask, that's what gives that significant improvement in the skin quality.
Now, I know one of my clients actually who comes to see you as well, because I definitely don't gatekeep on Dr. Cosima. I want to share that love. She was in the gym on Tuesday, I think it was, just this week. And I saw her again on Wednesday, and I was like, wow, your skin looks totally different today. She's like, oh, yeah, I used a CO2 mask. It was literally like night and day. It's crazy.
Absolutely. 45 minutes, and the difference in the skin, we often use it post-procedure as so use it after skin needling. You can even get it as a take-home package. So for people who are very time poor, like maybe it's not your first pregnancy and you've got other little ones around and you can't come into clinic, you can have this treatment at home, mix it up yourself, apply it to the face. It activates over 45 minutes, and then you literally just peel it off. So it's completely safe for anyone to use. You can use it, like I said, even post-skin needling, post-radiofrequency microneedling, which we also offer. And you literally, 45 minutes later, the redness is gone.
What about needling, like light skin needling, micro needling? Is that safe during pregnancy? Because
Yes.
Yeah.
It absolutely is. So what we do, again, tend to avoid is the anaesthetic cream during the pregnancy process. And that is because there is a level of local anaesthetic that you can reach in the body before it becomes a level of toxicity that can impact your heart rate. Now, obviously that's super, super duper high, but let's just pretend that you then walked out the door, fell over, broke your ankle, and had to have more anaesthetic. We want to avoid anything that's non-medical that's going to potentially then increase the risk of leading to a toxicity or not being able to have that medical treatment that you need.
And that answers the question about why it's not. I think that really makes sense now. Because it's like you don't want to be doing something that you don't actually medically have to be doing in case you need it medically. And I think with what happens during pregnancy is unpredictable, right? And touch wood, nothing bad happens, but things do happen. And at some point, people might need medical intervention of some sort, whether it's like your example, you've fallen over and you've broken your ankle, or even worse, you end up going into premature labor or something like that, and you need anesthetic. So that really makes a lot of sense now. So you don't want to be adding anything in that just in case.
Yeah, of course.
Okay, but
just for aesthetic reasons. So we want to leave it for medical purposes.
I remember when I was getting skin needling done, I was getting some pretty good results from it. There was no anesthetic going on, and the results were incredible.
And again, everyone's different. Everyone has a different degree of pain tolerance as well. So it's so personal. Know, however, that it is safe.
That's cool. I love that. Now, what about chemical peels? Because I feel like as soon as you think about chemical peels and pregnancy, you're like, oh, no.
Oh no. So
Yeah.
there are a lot of chemical peels that are pregnancy safe. So
Mm-hmm.
definitely lactic acid is one of my favorites
Mm-hmm.
because it's very gentle. It just targets the superficial layers of the skin. So
Mm-hmm.
it will remove any dead skin cells that make you look dull or dry. It actually hydrates as well.
Mm-hmm.
So that's the benefit of a gentle lactic acid peel. And I do one probably on myself every 2 weeks just to
Mm-hmm.
get that really beautiful glow. So it's going to help improve the skin, help improve the functionality of the products that you're using at home, which should be high quality, for example, like a compound serum, and it's going to maintain that glow in your skin. So, depending on obviously what the needs are, you can have some stronger peels, for example, even like glycolic acids, which a lot of people don't believe you can. It's the salicylic over 2% that you need to be cautious of. So generally, I would just say stay away from salicylic acid peels or any peel that has some kind of form of vitamin A in it. But again, different types of pigmentation peels as well can be used during pregnancy. So it's not across the board.
That's awesome. And let's talk about, because it's just popped into my brain, the difference between a peel and an exfoliant and why you want to be moving away from exfoliants.
Okay, so Tammy, there's a difference between a physical exfoliant and a chemical exfoliant. So we always recommend using a chemical exfoliant, and I ban everyone from using a beaded scrub. If they have one, I'm like, great, elbows, knees, feet, go for it. What happens when you're using even those little gentle micro beads is that you can create micro tears in the skin, you can create increased inflammation and sensitivity. So think of our skin cells as roof tiles essentially. So they're stuck together with cement or a glue. Now, if you get a little bead that comes in between that, it can unstick. So what that means is that you can develop more what we call transepidermal water loss. So you can lose hydration from the skin, but as well, you can increase the risk of inflammation and reactivity to the skin. So rather than a scrub, we use a gentle chemical exfoliant that's safe to use at home. A stronger version of that is a chemical peel, which is done in clinic. And the reason you can't do that at home is because the provider, for example, our dermal clinician who's actually got a Bachelor of Dermal Skin Science, so it's a university degree, they will need to watch how the skin is responding, how long to leave it on for to make sure that we don't penetrate too deeply into the skin. And again, that's why you want to see a provider that you can trust.
And there's definitely a difference between a dermal clinician and a beauty
Mm-hmm.
therapist.
Correct,
Yeah.
yes.
Yeah.
Yeah. Actually, 4 years of study to become a dermal clinician.
That's amazing, isn't it? Now, you did mention supplements, and I know that you took some internal supplements during your
Correct.
pregnancy.
Yes.
Can we talk about those a little bit? Because again, supplementation is something that I know for me, I can have those conversations with my clients, but I will always revert back to their healthcare provider to check. And there's definitely things that women can take during pregnancy. Do you want to talk us through the more skin-based supplements that you might provide?
Absolutely. So, depending on what the goal is, I tend to believe that during pregnancy, anything anti inflammatory is going to be of benefit.
Mm-hmm.
So, using, and again, it's related to that increased blood and oxygen requirement. So, one of the supplements out of the range that we choose is called My Collagen Lift. Now, originally I looked into that supplement for its collagen properties, but we know that there's so much collagen out there. There's so many different types of collagens. Obviously, I prefer marine collagen, but it needs to be a high quality so that it's really actively bioavailable. The one that I've chosen, and it took me about 2 years to research, is one from Switzerland, and it includes a very potent antioxidant called, Tammy, have you heard of it? Superoxide dismutase.
No, I definitely have not heard of that.
Okay, SOD. SOD for short. And so we can also add that into the skincare as a gentle form of a vitamin C if people are prone to breakouts, as an antioxidant. But I've had incredible results, and we can actually look at these results with the skin analysis scanner for inflammation levels before starting a course, a 3-month course of this, and inflammation levels after, where the skin's redness is significantly reduced just from taking those supplements. Now, remember, the skin is the largest organ in the body. If you've got inflamed skin, it's likely that there's something else going on internally. So again, I never say, okay, this supplement is going to fix everything. I'm a little bit like a investigative journalist or a doctor detective. I like to delve very deeply into my discussions about people's history, their diet, what they're doing, what they're using on their skin, what they've done in the past, what's worked, what hasn't worked, what's happened during their teenage years. It's so multifaceted. I spend a good hour investigating what's going on with someone's skin before I will provide an analysis, a skincare treatment plan, and moving forward, what we should be looking at doing in terms of additional services as well. So whether that's naturopathy, whether that's Tammy, whether it's other potential medical interventions, because not a lot of practices, and I've had this feedback as well, will focus on everything. And I think that's where the downfall lies.
It's interesting because it's that anti-inflammatory aspect of it as well. And I was having this conversation with a client recently, again, different client than all the other ones that I've mentioned, but we were talking about eating gluten during pregnancy. Now, this particular client that I'm referencing, she doesn't typically eat gluten, but because, and this was her thought process, and I hopefully changed that, but her thought process was she didn't eat gluten because she had some autoimmune things and she wasn't meant to eat gluten. But her thought process on this was like, if I eat gluten, then it might stop my baby from having allergies to it. So she was eating peanut butter and all of those common allergies, hoping that this will help her baby in utero not develop allergies as they get older. But I turned around and said to her, my argument against this, it wasn't the peanut butter and the peanut allergy type things. It was more about the inflammatory response that eating the gluten would have in her system that would be potentially damaging. So it's like your body's not meant to ingest gluten because it has an inflammatory response. We want you to minimize that inflammatory response during pregnancy because there's so much other stuff going on. We don't need to be adding that load to your body as well.
Absolutely. And I would have said something along those lines as well.
Now, let's look a little bit more towards the future. Not that we can see into it, but things are definitely changing.
Wouldn't that be nice or not?
I don't know. I think I'd be scared. But things are certainly changing in terms of women's health, and pregnancy is no different. But how do you see pregnancy safe aesthetics evolving?
Look, again, it's something that I very briefly touched on earlier, and I think it's prevention. So I think these days we're no longer reactive, we're proactive with our skin treatments and skin health. People are moving away from freezing and filling faces and working more towards health and wellness and healthy skin. And one of my missions is to actually help to create a change in the way that people approach appearance and healthy skin, to help change that across the board. This podcast is part of me getting that message out there that we should, if we focus on health and wellness, including our skin health and wellness, which is a whole category in itself, then we'll automatically have better skin moving through pregnancy, moving into the future, and we'll just need to maintain rather than repair significant amounts of damage. Especially living in Australia, there's so many allergens, pollutants, the pollens, especially in New South Wales, are so intense that our skin, of course, it's a barrier to the world. It's what stops the outside from getting in, and that's why we have an immune system. So skin is so important, and it always tells us the first signs of trouble. So we need to listen to it more. I think people in general are wanting to be more fit, and that's something that's happened over the last decade. That's now the norm. Whereas I think looking after skin and having skin treatments regularly, including pregnancy safe skin treatments, is not quite the norm yet, but it will become.
I guess that's making it more accessible to people as well, which is like maybe
Yes,
where all the home treatments come in that you've been
correct.
talking about. Because I think accessibility is definitely a part of it. But I think it's also education. And I think, that, again, that's what this podcast is about. It's about
Correct.
saying, hey, you know what? You might not be able to do XYZ during pregnancy, but hey, that's okay. Because why don't we use this as a time to work on skin health and actually look at what's going on under the surface of your skin. Let's see how we can help move you through this significant part of your life where there's a lot of change internally that does reflect externally in your
Correct.
skin, and see how we can help smooth that transition. So when you get to the other side, when you've gone through the full pregnancy, postnatal, breastfeeding gamut, you're not looking at your skin being like, oh God, now I need to fix this too. It's, hey, let's keep working with it throughout the pregnancy. And it's great to know that there's so much that you can do. You've got supplements, you've got compound serums, you've got a bionic laser that you can do through your first trimester, you've got other types of lasers and skin needling and things like that you can actually do throughout the whole pregnancy. And I think even just knowing this, people will feel a little bit more comfortable.
Yeah.
But I think the ultimate thing that we really need to drive home here is this: we're talking about doctor-led practices here. We're not talking about day spas. They're great for nice treatments that make you feel good, but actually what we're talking about here is doctor-led practices that can help make sure that we keep your skin beautiful and glowing and
Healthy.
and the question that I ask everybody that comes on the podcast is, what's the one thing you wish all women knew before having a baby?
I hate to say it, there's so many.
That's okay. Share as many as you want.
Look, it's something that I've only started training with Tammy just this year.
Mhm,
So my little one is about to turn 3,
mhm.
and that's something that I would highly recommend is part of the pregnancy process. Finding someone, and if Tammy's not available to you because she's the absolute bomb, then someone again that's well credentialed, that's got a really good reputation, that can help through the pregnancy process with pregnancy safe exercise to keep the body strong. Because I think what I didn't realize is really how draining it is. And of course, everyone says it, you don't know until you go through it, the sleepless nights. And I think the effect that has on your mental health is incredibly huge. Someone said to me the other day, oh, did you ever experience postnatal depression? And I always thought, oh, absolutely not. Everything was fine. I was just exhausted. And then sometimes you start thinking about it in more detail now that my first is almost 7, and you go, maybe it was. Because I think it's just so multifaceted that it's expected that you're going to be potentially a little bit upset, aggravated, exhausted, that it's going to be a tough time. You've got body image issues. It took me when someone told me it's going to take you 12 months to get back in shape, I was like, oh my God, you're kidding. No, that's not possible. I think I felt okay after probably about 18 months to 2 years. No one really prepares you for the extremes. People tend to, I think, over normalize it. I wish I would have known that I should seek more support. Even though there's things like Mother's Group, it's just not enough. It's just because everyone or a lot of women that go through pregnancy have a really difficult time postpartum for whatever reason, even if it's just lack of sleep. I think the amount of support required is undervalued. You should go out there and you should really just say, hey, I need this time for myself. I have to get someone to help me here and really look after yourself. That's what I would tell my pregnant self to work towards.
I think there's so much to that as well. I think the normalization of it is something, and we could go really deep into this. And is that because it happens to females? I mean, it happens to 80% of 50% of the population goes through this. Now, the normalization of it and the fact that this is just the way that it's always been, is that because it happens to females and we're underrepresented and we're undersupported? And there's so much data to back this up in terms of the gender gap in so many different aspects of it. And I think underlying what you're talking about, this is what underlies it all. And I think this is the thing that is slowly starting to change, is that we're
Very
slowly starting to not normalize what happens to women when they have children. And I guess we're educating more around that process and the support that you need, and talking about actually getting out there and seeking more support. But this is multifaceted, because when you talk about seeking more support, women never gave birth in such isolation before.
Right.
Like women used to give birth, and you'd have aunties and you'd have grandmothers and you'd have mothers all around, and there was such a support system. They were never this singular unit moving through life in just their family structure. It was like a bigger, more community aspect of it. And I think that's also what needs to change as well. Anyway, we could talk about this. This is going on to a whole other topic here.
Look, my closing comment, and I think this is something really important that someone mentioned to me this year only. And they said, just because it's a common experience doesn't make it any less significant.
I think that's it in a nutshell, right? Yeah, absolutely. Yeah, absolutely. I love that. And
so
I think
let yourself, if you're struggling, let yourself feel it. It's okay. Don't say to yourself, and this is what I did, everyone's going through it, so toughen up, because that's not helpful.
And I think that's such beautiful words to leave this podcast on. Thank you so much. It's been incredible. And thank you so much for sharing from your wealth of knowledge. I appreciate it so much.
My absolute pleasure. And thank you, Tammy, for doing this and providing this opportunity. I think it is of the utmost importance for women, and I'm so grateful to be a part of your community. So thank you.
And if you're hearing this message, I want to say a huge thank you, because it means that you've listened to this entire episode. Of course, if you have any questions about the things that we covered in this episode, or want to know more about me or my other projects, you can find me on YouTube and Instagram at The Pregnancy Process. For those currently in their conception or pregnancy journey, you can actually apply to join my complimentary but private community, the Preggy Training Crew. And you'll find my community application and social media links in the episode description. And of course, if you enjoyed this episode, I absolutely encourage you to share it with other women just like you. And I look forward to seeing you in the next episode.